another artist who works with humans now.
Absolutely.
Yeah?
That's
but
what I do.
Art of a different form.
Correct.
And you are Dr. Wendell Bobb.
Yes.
And you are considered a triple board certified. I was going to say a triple threater.
No, well, it depends on who you ask.
Yeah, I was like, but triple threat means a good thing. It's like you're so talented in so many ways.
Okay.
But I meant it because you're triple board certified physician, American Board of Psychiatry and Neurology, Neurology, Clinical Neurophysiology, and Sleep Medicine. When did you find the time to study all of that?
I don't know. I was trying to get extra hours in a day, but God didn't allow it, so I somehow had to fit it in.
Do I detect a Trinidadian accent?
Absolutely.
There?
I was born here. Proud Trini. Okay?
Yes, because I spotted you on Facebook, and I said, he's gonna make a good TT Talent Abroad. We have a segment called TNT Talent Abroad.
Really? Oh,
but then he came to Trinidad, so you're in studio right
perfect.
now.
You see, it happened as it's
So a little bit of the TNT Talent Abroad is it's meant to inspire other young people from Trinidad and Tobago when they see you guys out there doing it. So I just want you to tell us a little bit about your journey and how you became, triple board certified.
Sure. So, I was born in Trinidad, actually San Fernando. Went to St. George's College, and after A-levels, I migrated to the U.S. And I did a bachelor's in chemistry. I went to medical school, and I loved the brain. I just thought it was so alluring and so captivating. So I studied neurology. So I did that for 4 years, and then I did what we call a fellowship at Duke, and I did that in clinical neurophysiology, essentially studying like the brain waves of the spinal cord waves, as well as sleep medicine.
And was this something you knew you were going to do, or you ended up doing? From school days, for example.
Sure, no. So I've wanted to be a doctor for, well, at least my mom tells me I wanted to put water in a needle. When I was 3 years old, that's the term I would say. So of course, in the rudimentary brain, I didn't know the word syringe, right? So I just said needle. But anyway, she said I used to say that when I was about 2 or 3 years old. So perhaps the seed was there from some
it was
time.
planted. So why are you in Trinidad and Tobago now?
Sure. So I'm here for a Seizure Awareness Conference put on by the the Seizure Awareness Foundation of Trinidad and Tobago, founded by Ms. Nicole Vanderpool. And it is important to spread awareness for seizures because people don't really understand it. Sometimes, there's just, people are very guarded who may have epilepsy, and people don't even understand
Well, some people get afraid when they
get
see
afraid.
someone. They
Absolutely.
get a fit, you know, and they don't understand what to do.
So we want to let people know, what do you do when you see somebody who, have a seizure?
Yeah, and this is Seizure Awareness Month.
That is correct.
Right, and the conference is part of that.
That's
we
correct.
will be continuing. I think you met Dion Batiste from our newsroom.
I have,
so we're doing a segment with her next week.
Oh, great,
To keep the nation aware of some of the practices to implement with persons when they have seizures. But right now, you brought a brain for us?
I did, a model of a brain, yes. So I did this because it helps to explain seizures, right? So a seizure essentially is an abnormal surge of electrical activity in the brain. And that can result in what we call a clinical manifestation, so a behavior or a perception that the patient has. So one of the most common types of seizures is called a generalized tonic-clonic seizures. So it starts in part of the brain, such as for example, the temporal lobe. Okay, and it will be here on this side, and it starts there.
So this is the front of the face here. This is
this is actually front of the face. Exactly. Right. So this is the frontal lobe, and so there are 4 main lobes: the frontal lobe, the parietal lobe for sensation, and the occipital lobe for seeing, and then the temporal lobe that has a lot going on with memory and emotions and different things like that.
Right.
So most seizures start in the temporal lobe, okay, to the side here.
Yes.
And then it spreads to the rest of the brain.
Yeah.
Okay, and that results in people.
So let's show that again because we
sure,
now have it
absolutely.
So it starts on which part?
There we go. So it starts around here in the temporal lobe, or deep to the temporal lobe, and then it spreads to the rest of the brain. So people may have symptoms such as hearing a freight train, or having abnormal tastes in their mouth, and then they may turn to one side. Their head may turn to one side, and they lose consciousness. And that electrical activity, almost like a short circuit, spreads all over the brain, causing them to lose consciousness, stiffen all over, and have generalized shaking. But interestingly, not all seizures look like that. Some seizures, like kids, for example, in absence seizures, they may lose awareness for about 10 to 15 seconds. And parents and teachers may just think, oh, they're daydreaming or they're not paying attention. But we can see that abnormal activity on the brain.
How can the teacher know, though?
So that's where if they suspect there's a problem, so if they, calling the child's name and the child isn't responding, they should see a neurologist, because what the neurologist is able to do is hook up what we call electrodes to the brain.
I've had that done.
Oh, there you go.
I have had that done.
All right.
Yes, yeah.
So you hook electrodes
like for a week.
Oh, really?
And then you
Yes,
monitor it?
absolutely, yeah. And sometimes it doesn't even take a week. So you can have a child who can hyperventilate, and that could induce these abnormal activity on the brain. And we could see it, and you can treat them.
Yeah. What about epilepsy? Because that's the one that we hear about all the time.
Exactly. So epilepsy is defined as having 2 or more unprovoked seizures. Now, what is an unprovoked seizure? An unprovoked seizure is a seizure in which there's something wrong with the neurons or the nerve cells in the brain itself. And this is what provokes or triggers a seizure, as against a provoked seizure where there's something outside of the body or in the body. So for example, a drug of abuse such as cocaine, or if someone has kidney disease or liver disease, that could actually produce a seizure with normal brain cells.
And you spoke about drug of abuse and controversial marijuana used for seizures. What's your thinking on that?
Sure, yeah, there's definitely an upsurge in interest with marijuana right now. So it's important for people to remember that the raw form of marijuana contains 2 main components, THC or tetrahydrocannabinol, as well as CBD, cannabidiol. It is the THC that's responsible for the psychoactive components of marijuana. So that's what causes people to get high or to feel, to get stoned or, to hallucinate. Slow down, exactly. To sort of like, oh, things are good.
Chill.
Right. But it is the CBD, the cannabidiol component, that is used to treat seizures. So that doesn't cause people to get high and all of those things. And that's what's effective. It has a neuroprotective effect, and it could actually help seizures. But it's important to note it's only approved for 2 types of seizures, Dravet syndrome, Dravet as well as Lennox-Gastaut syndrome.
So you have to know what you have.
Exactly, which is usually common in kids.
Okay, well, the conversation about marijuana is a completely different conversation.
Yeah, that's a completely
so we'll have that at another time. Sure. But what are some ways to treat, can people treat seizures?
Certainly, so the most common way is using what we call AEDs, or anti-epileptic drugs. And there's several that are available, and the goal is to help decrease the frequency of these seizures. And one of the other main ways is if someone has failed 2 or more anti-epileptic drugs, they should be referred for surgery, because as I mentioned, many seizures start in a particular part of the brain. So if we can detect where they start, then surgically you remove that focus, and there's a significant amount of people who become seizure-free, at least 60%.
Well, I can go on and on because you're so captivating to listen to. And you will be speaking at the Seizure Awareness Conference. Remind us again where that will be.
Absolutely. So it's going to be this Saturday, November 17th, at the Central Bank Auditorium at 3 p.m. And people do need to, you don't have to, but we recommend people RSVP at the Seizure Awareness Foundation page at Trinidad and Tobago, or call or text 737-0535 and to guarantee a seat.
All right, so we're going to leave that number with Noreen, 622-4141. Of course, you call her and she'll have the number if you need to register. Yeah, because sometimes people don't get to write it down.
Sure. And it's free.
It's free. Most importantly.
It is free,
I hope you have enough seats. Dr. Wendell Bobb, we're going to stay in touch with you when you go back. Maybe we can do a Skype session.
I'd love to do that.
That would be wonderful. You're a Trini man.
I'm a Trini. I have to do it, yes.
Yeah, and we're proud of you.
Thank you so
board
much.
certified physician. Board of Neurology, Clinical Neurophysiology, and Sleep Medicine. When I call you, when I Skype you, we'll talk about sleep medicine.
Let's do that.
Okay, let's do that.
Thank you so much for having me.
All success with the conference.
Thank you.